So myHappymind was created by myself because I saw this huge gap in the provision of good mental health education in primary schools. So when it comes to kids' mental health, what we often talk about is CAMHS referrals, needing to reduce the burden on CAMHS. What we want to be talking about is how do we prevent children getting to the stage that they need CAMHS in the first place. So that's what we do. And it came about based on a couple of personal experiences that I had with my own child really struggling. And me figuring out that there was a big gap here and I wanted to be part of the solution. So I used to be the global head of talent and development for AstraZeneca. So obviously everybody knows who AstraZeneca is now post-pandemic. So I used to work with the senior leaders in that organisation to help them build resilience, good self-esteem and well-being in those organisations. So I was an expert in the science of happiness and well-being, and I basically realised that everything I knew could as equally be applied to kids as it was being to adults, and so it felt like a good thing to do. I think the big thing for us was being able to evidence impact and being able to show that what we do is having a real impact in schools and for the NHS. So as an example, we've proven that our programme massively reduces CAMHS referrals, which is something that everybody cares about. So once you have that data, it's definitely easier to get into the conversations. Health Innovation Manchester have been really, really key to us in terms of helping us to connect the dots, because the NHS is a complicated beast as we're continuing to learn, and they've really helped us to connect the dots in terms of who's who do we need to connect with, and also presenting our story in such a way that it's going to be really compelling to the NHS. So they've been amazing. We're already commissioned by 7 CCGs, working in hundreds and hundreds of schools, which is fantastic. So for us it's just about more of the same, getting in front of the people who can make those decisions to help impact children's mental health.